Bladder leakage, otherwise known as urinary incontinence in women, can be difficult and sometimes embarrassing to deal with. In this video, we're going to work through the best tips to help with those symptoms. Now, before we begin, if you want more information on bladder leakage, what causes it, everything about it, it's all going to be in the description below. But now, let's begin with those tips. Okay, so let's begin with tip number one. Tip number one is I really want you to think about how much caffeine you are having during the day. Keep a log of it, maybe a diary of it on your phone. Write down how much caffeine you're having. Caffeine is found in many different things, from coffee to teas to energy drinks, okay, to different types of fizzy drinks that might have some caffeine in them. So you really need to find out how much caffeine you're having and really try and reduce your caffeine intake. This is really going to help. We spoke about how caffeine affects the bladder as well earlier in this video. You also need to look at how much alcohol you're consuming as well, okay? Alcohol is a natural diuretic, so it makes us wee more often, okay? It causes us to take more urine into the bladder, which isn't going to help with those incontinence issues. So again, you need to look at how much alcohol you're having and try and cut down, okay? If you can completely stop, this is going to help even more, but if you can't completely stop, you need to stay within the recommended limit, which is 14 units per week with alcohol-free days. I will leave more information about this in the description below as well. Now, interestingly, drinking too much or too little fluid can actually make your symptoms worse. Sorry, I had to stand up. My legs are getting very tired, but obviously drinking too much fluid is going to make us wee more, okay? That's pretty obvious. But drinking too little fluid is going to mean that our urine is more concentrated and it's going to aggravate the bladder lining, which is actually going to make things worse, okay? So we need to make sure we're drinking the right amount of fluid, okay? The recommended amount of fluid, 6 to 8 glasses a day. But please remember that it's not just water, you get it from the other fluids and foods that you eat as well. That does all count towards it. And also making sure we have a certain cut-off point as well, so we're not drinking past a certain time, we're not drinking too late, otherwise we're going to be up all night going to toilet. Moving on to tip number two, minimizing certain foods that we know make bladder symptoms worse. So for example, certain citrus foods, oranges, limes, grapefruit, okay, all of these can potentially make symptoms worse, even in their juice form as well. Spicy foods, tomato-based sauces, okay, even certain chocolates as well, they've all been shown to potentially make symptoms worse. So what do you need to do? Well, you need to really think about it. How much of these are you having? And potentially maybe keep a diary of potentially cutting down on them and seeing if there's any improvement. I wouldn't just stop all of them straight away, okay, because it might be certain ones that aggravate your symptoms more compared to the other ones. So keep a diary, see which one works for you, see which one doesn't affect you at all, okay? That's probably the best advice. Now moving on to tip number three. Tip number three is more long-term advice as well. If you remember earlier, we spoke about how pressure on the bladder can make symptoms worse. So please remember, if you are overweight, that will be putting a lot more pressure on the bladder. So potentially trying to lose some weight will potentially help with those symptoms as well. If you want to check if you are overweight, for example, you can check your BMI, which I will leave a link to in the description below, just to check if your weight status is good. But if you are overweight or obese and you want to lose some weight, I do have some really good videos which are all scientifically evidenced to show how you can lose weight, okay? So if you're interested, I'll leave a link to it up here and a few in the description below as well. Okay, so the next tip that I want to discuss is pelvic floor muscle training, okay? I feel like this video wouldn't be complete if we didn't speak about it. So the pelvic floor muscles are basically responsible for controlling the flow of urine, okay? So they control the flow. So if we're able to strengthen those muscles, it will help with our symptoms. And there's a lot of research on this. This is all scientifically backed. So the next thing I want to discuss with you is how we can potentially strengthen our pelvic floor muscle. Now, before I go through this exercise, please first speak to your healthcare professional first to make sure that you're appropriate to do pelvic floor strengthening exercises, okay? Because they can actually harm some people by doing these exercises, okay? If they're not done correctly, they can cause a lot of discomfort during sex, for example. If the exercises are done whilst actually urinating, they can cause damage to the bladder or the kidneys. So please always first speak to your healthcare professional before doing any pelvic floor muscle exercise. Okay, so first of all, how is the exercise done? Well, the first thing we need to do is we need to locate the correct muscle. The best way to do this, sit down with your knees apart, and we're trying to find the muscle of our back passage, okay? And the best way to find this is to tense that area as if you're trying to stop yourself from passing wind. That's probably the best way to describe it. Okay, and now pretend you're sat on the toilet, okay, and you're about to urinate and you're gonna stop it, okay? It might feel a bit more difficult and a bit different, okay, but it's the same area that we're looking at, okay? Once you've got that and you mastered it, the next thing you need to do is imagine you're both passing wind and passing urine at the same time and you're trying to stop them. So focus on using both of them muscles there, that muscle in that area basically. Don't cross your legs, keep your legs open. Don't tense your stomach, okay? Don't tense your buttocks, your butt cheeks or anything like that, okay? Just tense that area. That's the only part that we're working on here. So that's a really important bit to remember. Okay, so now that we've located the muscle and we know what we're doing when we're tensing that area, the British Association of Urological Surgeons recommend that we need to train both our fast and slow acting muscles, okay? So for our slow acting muscles, what you need to do is you need to hold that area for 10 seconds. So hold the muscle for 10 seconds to tense it. Make sure you're breathing, make sure you're not tightening your buttocks and your legs are open and you're not tightening your belly or anything like that. We're just isolating that area. So hold it for 10 seconds, then rest for 4 seconds, and then repeat it 10 times, no more than 10 times. And for fast muscle activity, the same area that we've been tensing for 10 seconds, this time we're gonna do for 1 second, okay? So tense for 1 second and release. And we're gonna do this 10 times. So that's our fast muscle activity. That's the 2 exercises. So we had slow muscle activity and fast muscle activity, okay? You can repeat it up to 6 times in a day. So the next thing I want to discuss is seeking medical advice. Please, if you're having any bladder leakage or incontinence, whichever you want to call it, please speak to your healthcare professional. That's the most important thing. We spoke about some of the causes that might be causing the incontinence, but please remember as well, one of the less common causes as well can sometimes be bladder cancer, okay? And this is why it's so important that we get our healthcare professional involved. If you're having any sort of symptoms, if it's just started, if it's been going on for a while, please don't hesitate to contact them and they will investigate it to make sure there's nothing else that's sinister that could potentially be causing it. Please also remember that if you live here in the UK, you may be able to access the NHS incontinence services. Some places you can self-refer, some places your healthcare professional will need to refer you on, so please be aware of that as well. I don't know how it works in other countries, but again, your healthcare professional over there will be able to help and support you with this. So it looks like we've come to the end of this week's video. I really hope that these tips help you, and as I always say at the end of every single week's video, always remember that you're awesome and I will see you next week.